Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, everyone's favorite OBGYN, and I would like to officially welcome you to episode 303 of the Ask Dr. Angela podcast. It has been a long time since we convened. There's been a lot going on in my realm. In addition to all of the changes that are impacting us due to many community-based lockdowns, or I guess I should say advisories to stay at home, last year was probably one of the most tumultuous years of my life. I am happy to say that I am finally through what was a not so pleasant divorce. I don't know that really there ever is a pleasant divorce, but I'm finally happy to have that behind me and to be able to get back to doing what I do best. I am well. My daughter is well, and she has adjusted to the changes beautifully. But I'd like to really just thank all of you for your continued support, all the love, all the well wishes, all the inquiries as to where the hell have you been and when are you coming back? People have been emailing me, direct messaging me, and I'm finally happy to say that I'm back and really better than ever. So with everything going on, I thought that we'd, come back and, get right into the mix of things and talk about, the coronavirus. And specifically, I'm going to talk about how the coronavirus is affecting pregnancy care, etc. There will be a whole series of podcasts directed towards this, but we're going to start first and foremost with, pregnancy and what should pregnant women do to avoid getting the coronavirus. What we know about the coronavirus, and certainly we are finding out new things every day. I feel like the guidelines are changing every day. If not changing, there are new implementations to the guidelines every day. I keep the CDC webpage in my browser open so that I can check it daily. And, I'm checking it multiple times a day just to stay on top of things. But this is what I'm telling all of my pregnant moms. Really, the recommendations are no different for pregnant women with regards to safety as it is for the general population. Pregnant moms and women need to do the same thing that everyone else in society is doing. Wash your hands often with soap for about 20 seconds. I can't tell you how many times personally I wash my hands daily. So in addition to washing your hands, make sure that you're cleaning your hands with a hand sanitizer that contains at least 60% alcohol. If you can't wash them. And, if you're using a hand sanitizer, you're going to want to make sure that you are washing or rubbing your hands until they feel dry. Now, this next recommendation is a tough one. Try to avoid touching your eyes, nose, and mouth. I mean, we do this without even thinking about it. So we're going to have to put a lot of thought into trying to avoid touching your eyes, nose, and mouth. And then this one seems like a no-brainer, but a lot of folks still are not doing this. Stay home as much as possible. This seems to be very trying for most people. I really wish that I could stay at home, quite frankly, but unfortunately I'm essential personnel and that's not quite possible. But really, stay at home as much as possible. Try to stay at least 6 feet away from other people if you go out. And quite frankly, I try to stay further away than that because there is, some new research that shows that, the virus droplets can travel more than 6 feet. Some of the literature that I've read suggests that it can travel up to like 24, 25 feet. The other thing is avoid people who are sick. So when I see my pregnant women for their routine prenatal visits, in addition to the normal things that we talk about, prior to letting them exit the room, I always tell them, number one, fetal kit count if you're greater than 28 weeks. And also, lots and lots of hand washing and avoiding sick contacts. I'm going to say that again, avoid sick contacts. When you're out in public, I would advise wearing a mask. During my visits in the office that I work for, shout out to Healthy Woman, we do wear masks when we're seeing the patients. Our patients are also wearing masks. So in general, please, please, please be safe. Please try to adhere to the guidelines. Things that seemingly are so simple really do make an impact. So hopefully that has provided you with some helpful tips during pregnancy to help you to avoid getting the coronavirus. I'd like to personally thank you for tuning in to this episode of the Ask Dr. Angela podcast. There is going to be a lot more where this came from. I'm super excited to be back. Please, please, please keep your eyes and ears peeled. Many more podcasts to come. The blog post is also back and in effect. Please follow me on social media. I'm on Twitter, Instagram, as well as Facebook. You can visit me at www.askdrangela.com. That's AskDrangela.com. In closing, I'm going to leave you with with a quote from one of my favorite inspirational books. This is by Sandy Gingras. The book is She Went Out on a Limb, and it's a book of inspiration for women. I'm going to leave you with this. One step at a time. Remember that. One step at a time. Until next time, look better, feel better, be better. Cannot wait to reconnect with you on the next episode of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.